Good afternoon, Doc. Good afternoon, Miss. I am Princess Katapang, student nurse from Southwestern University, Finland, and today I'll be assessing your head and neck. So the initial steps is to identify the data. This is to make sure that this is the right patient to examine. So may I know your name and birthday, Miss? Okay, so the purpose of this examination is to detect any illnesses or diseases and conditions might be present in your head and neck and to do something about it. Any questions? Okay, since we're done performing hand hygiene and we also wear gloves, next is to, in assessing the head and neck, first we need to assess the head and eyes of the patient. First is to I will inspect and palpate the head and skull. I will note for face color, symmetry, and lesions. Upon inspecting and palpating the face of the patient, there's equally distribution of hair, no alopecia signs, no lesions, and no masses. Next is to inspect the external ear, examining the eyebrows, eyelashes, eyeball, and the eyelids. The patient's eye structure is all aligned. Next is to examine the pupil for equality of size, reaction to light by darkening the room. Can you please turning off the light?
One lang, upper lang. Okay.
Okay, from lateral to front. Okay. So the pupils, the patient pupils is constructed, therefore it's normal. Next is to test for pupillary accommodation and convergence. By asking the patient to focus on the object as I bring it closer to the nose. Okay, miss, can you focus on the objects and do move your head? Okay, so the patient pupils are equal, round, reactive to light, and accommodation. Next is to, using an ophthalmoscope, I will check for the patient's red reflex to see if she has any diseases such as glaucoma or she has any cataracts. Okay, next is to perform the visual acuity by asking the patient to stand at a distance of 20 feet. Okay, and I will ask the patient to read the smallest letters in A.
D, E, F, P, O, P, C.
Okay, so the patient grade is 20/20, which identifies it is normal. Next is to, about 1 to 2 feet away, I will ask the patient to focus on my fingers with the patient's moving eye. And can you miss focus on my fingers and please don't move your head. Okay, upper right, extreme right, lower left, upper left, extreme left, lower left. Okay, we're done assessing the head and eyes of the patient, and we will proceeding to the assessing the ears. Inspect the ear bilaterally and palpate the mastoid process. Okay, do you feel any tenderness when I palpate it? Okay, so the patient doesn't feel any tenderness when I palpate her mastoid process, therefore it's normal. Next is to, using an otoscope, I will inspect the internal ear of the patient to visualize the tympanic canal and tympanic membrane. Okay, the tympanic canal is clear and the tympanic membrane is intact with pearly green color and positive wrist light reflex. Next is to test the hearing of the patient by asking the patient to stand up And I will be staying at the back of the patient 2 feet away. And Miss, can you follow my voice? If what will I say? Okay. Okay, so the patient is able to follow the words that I said. So she has a positive hearing test. Next is to use the tuning fork to perform the Weber's test for lateralization by stroking the tuning fork and put it in the cranial of the patient at the central. Do you feel any lateralization? Okay, so the patient did not feel any lateralization, so therefore she is normal. Next is to perform the rings test by stroking again the tuning fork and put it in the stem of the mastoid process. Do you feel for ringing sensation, miss? No? How about this? Okay, so the ear conduction of the patient is longer than the bone conduction. Next is to, after assessing the ears, next is to perform assessing the nose of the patient by inspecting the nose and palpate it. Next is to palpate and lightly percuss over the frontal and maxillary sinuses of the patient. Do you feel any pain or tenderness when I palpate it? Okay, so the patient didn't feel any tenderness when I palpate his frontal and maxillary sinuses. Therefore, she is normal. Next is to using an otoscope. Before that, I will include the patient's nose. Can you? I will feel the breathing. Inhale, exhale. Okay, other side. Inhale, exhale. Okay. Next is to using the otoscope. I will examine the internal nostrils of the patient. Okay, so the internal nostrils of the patient is clear and doesn't have any mucus. Next is to assessing the mouth. First is to assess the temporomandibular joint of the patient by placing my index finger in front of the ear and ask the patient to open and
Perform
close.
hand hygiene.
May open
Perform
your
hand
mouth.
hygiene. It may help to prevent
Next is to-
any infections.
Next is to inspect the lips, oral mucosa, hard and soft palate,
and assessing
teeth and salivary breathing by asking the patient
step would be
to open mouth wide
finger
and by using a tongue blade or a tongue depressor
asking the patient to
and a pen light.
her mouth.
Okay, stick out your tongue. So as I push the patient's tongue, she doesn't feel any swelling. She doesn't feel any tenderness or pain when I touch it. Next is to
And also
by sticking out the tongue of my patient, I'll ask the patient to open her mouth and she will push the tongue blade to the left and to the right. Next is to inspecting the ovula of the patient with her tongue out by saying open your okay. Next is to palpate the muscle tone and tenderness of the patient's tongue.
next is for the patients
Okay, patient's tongue any signs of tenderness in my patient's tongue, so we need to
any inflammation around the
remove the gloves. Next is to in assessing the posterior triangle of my patients. I'm using my finger pads in a slow circular motion. I will place it in the
help
forehead
check if there are any inflammation, any signs
down to the posterior triangle
oral cavity of the patient.
of the neck and the posterior cervical lymph
For
nodes.
this is we're going to proceed in assessing the posterior neck.
Next is
So the
to
first step in assessing the posterior neck is
inspect and palpate the front and behind of the ear,
front of the
behind the ear, the posterior, and the chin, then anterior cervical lymph node. So there's no any tenderness when I palpate the patient's cervical lymph nodes. Next is to
Next is
inspect and palpate the my patient's carotid artery. First is the left artery, right artery. Make sure one artery at a time. And using the bell of stethoscope,
Next is we're going
I will auscultate the patient's artery.
artery of our patient. The carotid artery of the patient may indicate for the pulse of our patient. So we're going to use our
And right.
fingers to or palpate for the patient's carotid arteries.
Next is to assessing the anterior triangle of my patient
Right to left.
by
And we're going to use the stethoscope. When using the stethoscope, you're going to use the bell in order to hear the frequency of the sound to our patient's carotid
to inspect the trachea. Do you feel any pain or tendinousness? Next is to inspect the thyroid gland. So as I inspect the thyroid gland of my patient, there's no any enlarged part, so there's no need for us to auscultate it. Next is to inspect the ability of my patient's neck by asking the patient to inspect the supraclavicular area.
Yes. Now we're going to proceed to assessing the trachea of our patient. It is necessary to
So last is
assess
to
the
inspect
indicating
The patient's ability to move his neck by asking the patient to touch his chest using her chin. Okay, to chin is right
The next
shoulder.
step will be to assess for the
Left shoulder.
thyroid gland of our patient.
Here
Thyroid
to
gland
right
is
shoulder.
about
Here
here.
to left shoulder.
And check for
And
any lymph nodes
tip
or
her
any
back as
enlargement
far
or
as you can.
thyroid gland of our patient.
Okay. So we're done assessing
After
the
this,
mouth
we're going
down
to
the neck.
check the nose.
Let's perform hand hygiene and document the findings of the assessment.